Hello, this is Paul Ricci. I'm here with Diego Chavez. He's agreed to come and interview me for, be interviewed for Salud para Ninos. This is a free clinic Diego has created. It's in its 20th year right now, and they're serving the Hispanic community, like for children. So I'm going to share the screen. Oop, wait a minute. All right, let me change this here. Sorry, I'm always get clumsy sometimes here. The screen. So yes, this is the image of from their Facebook page. Okay, so yes, they have been active for 20 years, and I'm sure they've been busy right now. Like here, they're advertising like for every Tuesday in the morning that they will be offering vaccinations for children, which is very important. I guess like all children can now be vaccinated for COVID. So, okay. And so hey Diego, tell us more about the clinic.
Hi, Paul. Thank you so much for having me. It's a pleasure to be with you today. So
Mhm.
yes, Salud para Niños started 20 years ago, and actually Salud para Niños are the three words in Spanish for health for the children. And Salud is an acronym that stands for Students, Residents, Faculty, and Latinos United Against Health Disparities. So one of our main goals is to address health disparities in the community, mainly in the Latino community, but throughout our program, we actually have been able to help many people who are not even Latinos. One of the ways that we address disparities is by addressing barriers to healthcare access. So one of the things that we do is try to learn about the barriers that people face to have access to healthcare. And once we learn about those barriers, we try to address them, and with that, we're addressing health disparities. So one of the biggest things that we learned 20 years ago was having another language as a barrier. So for
Mhm.
that, in our clinics, we have bilingual providers. We start offering clinics in Spanish, but with time, we have seen more and more people coming to our clinics who speak other languages. We serve a large proportion of the population who are Brazilian. So even though I personally don't speak Portuguese, we have an interpreter in the system that can help us with that. And as I said before, we actually have been helping families from all around the world. So as recent as a few months ago and weeks ago, we have been seeing, for example, families coming from Ukraine. So again, I was mentioning one of the barriers being language. Cultural is another sometimes barrier. We know that when the provider and the patient share the same culture, the encounters are better, and the possibility of access to healthcare actually is improved. Another barrier that we have identified is lack of insurance. Right now in Pennsylvania, there are 24,000 children, and I'm not talking about only Latino children, 24,000 children that will never have access under the current circumstances to health care and to health insurance in our state. And it's really sad because actually other states around the country are doing much better than Pennsylvania. Illinois, Massachusetts, California, New York, they have true universal health care for all their children. In
Mhm.
Pennsylvania, there are many groups trying to advocate for this. There is a group out of Philadelphia called Children's First, who is trying to change some part of the legislation. And with that, the medical assistance can be extended to all children, and the coverage will be better. And
So,
actually, that would
that would be regardless of immigration status.
yeah, exactly. And actually, immigration is, some people think about it is whether you're documented or not. But the truth is that we have, for example, people who are documented who still don't qualify for insurance. So in order to qualify for insurance, you have to be a citizen, you have to be a resident. But we have, for example, many people who are in our state who are as students or in work visits, and those kids won't qualify for health insurance. So they can be fully documented, but they still won't qualify for health insurance. So having the change in the legislation will be a great impact, because those 24,000 children could benefit from many programs. And more important than anything, one of the things that we do as Salud para Niños is preventive health care. So once you invest in preventive health care, you're actually saving money. Once you give vaccinations, you're saving those kids to end up getting sick, going to the hospital, being admitted. The COVID-19 pandemic proved that, once we start getting the vaccines, investing in the vaccine was cheaper than to start investing in intensive care units and people being admitted to the hospital and
Ventilators,
beds.
yeah.
So we do put a lot of emphasis on prevention. We want to address those barriers. I mentioned already language, culture, um, insurance. Another one that is sometimes a barrier is transportation. So we have a mobile unit and we try to have our clinic in 3 different locations. We're in Oakland, we're in the south side, and we're in Beachview. And yeah, we would love to be able to go to all places, but unfortunately, the resources are limited.
Mhm.
Over the last 20 years, we have grown, but
Yeah.
we're hoping to continue growing over the next 20 more years, if possible. So yeah, we're very happy what we have done. We have made a big improvement in the community. We offer a free clinic for those who don't have access to health insurance, and that's great. And through some partnerships, sometimes we can provide some specialty care for those kids. But there are many things that we're still limited to because those kids don't have health insurance, and it's sad. And again, it's something that if we invest on preventive care and we invest in health insurance, in the long term, we're going to be saving. So if I can
Yeah.
share a message with your audience, Paul, is that we should be thinking about how can we save in the long term, but making sure that everybody has access to health care and that all our children in Pennsylvania have health insurance.
Okay. Yes, yes, so certainly. I mean, so the patients you see, are they mostly from right around Pittsburgh, or do you get some from, say, outside of Allegheny County?
We serve the 7 county area in southwestern Pennsylvania. So Allegheny, Beaver, Butler, Washington. Sometimes we have families as far as Armstrong County, Westmoreland, Fayette, Indiana. Um, there was a period of time in our clinic that we actually took the mobile unit to Washington County, to Canonsburg. We can no longer do that, but we still have families who come, and it's hard for these families to come, but they make a big effort to make sure that the kids have their vaccinations, they have their appointments on times, and they can go to school, which I give them a lot of credit to the families. Just right now, as we're speaking, it comes to my mind somebody whose kids needed to have their vaccinations and their health assessments ready to be able to go to school. And this is a family who lives in Charleroi. They
Mhm.
have to wake up at 5 a.m. to take 2 buses to make it all the way to Pittsburgh so I can see them. So it's hard for the families. We try our best to tailor to these families, to help these families, but it's also a testimony of how important for these families, how invested they are in making sure that their kids are healthy and that they go to school. And actually, that's the ultimate goal of our program, that these kids are healthy, grow up well, finish school, and once they graduate from school, they can give back to the community.
Okay. So, yeah, I mean, I was looking at county health rankings before the interview. I don't know if you're familiar with them. Like, like that, I guess they do a lot, they compile lots of statistics for each county in the US. And, I was putting some together, say about Pennsylvania, the US, in Allegheny County. Okay, let me bring that up. Okay, yes, down here. Like I was looking at, say, infant mortality rates in, let's say, like comparing Allegheny County to Pennsylvania and the US. I mean, I didn't have any, say, for the Hispanic community, there was no data for Hispanics in Allegheny County, but the infant mortality rate amongst Hispanics is higher than it is for the US, you
In
know.
Pennsylvania, yeah. Yeah, I will say my guess, if we had some numbers for our region, is probably better.
Hmm.
Um, these numbers, what it's called my attention, that are astonishing, and I know there are a lot of people working on this, is in particular the African American community. I mean, this is huge. If you see the numbers of the African American community at the state level, nationwide, at the county level, compared to the nation, even compared to Hispanics, is huge. So I know there are many efforts at the county level, in particular, in working in these health disparities. And it's not only infant mortality, but it's also maternal
Yeah.
mortality during childbirth. So yes, this is huge. And again, a lot of these things can be preventive if the
Hmm.
kids if the parents actually, this start before they are being born. So if the mother gets good prenatal care, good attention to the service that they need, and then once the baby is born in the proper conditions with the
Yeah.
appropriate care, and the acute needs are being addressed early on. So yes, this is something that shouldn't happen. I mean, we're talking about the United States. Um,
Yeah.
And to see these numbers in our country, in our state, and in our county, yeah, it's
Yeah.
really, really sad to see what's happening with some segments of the population.
You know, of course, I also looked at life expectancy. You know, they do have actually sometime in general in Allegheny County, maybe it's because of a smaller population, but actually Hispanic life expectancy tends to be higher than, higher in Allegheny County than it is for the state of Pennsylvania.
Yeah, and if you look in general for the U.S., well, yeah, for the U.S. and for the county and for the state is higher. There is something that is called the Hispanic paradox. I'm
Yeah.
pretty sure we have talked about this as part of our studies in public health. Um, there are many things that talk about the Hispanic paradox. Some people said that one of the reasons that the Latino community do better in sedentary index, sometimes infant mortality, sometimes adult mortality, cardiovascular conditions.
Yeah.
There are many explanations. So one of the theories is that immigrants tend to, in particular, first generation immigrants tend to keep some healthy habits that they bring from their own country, some healthy
Yeah.
traits, eating more veggies, eating less processed food, being more active.
Yeah.
That's just a theory, it's a possibility.
Mhm.
Another theory talks about the fact that, and of course, this might be influenced to this, is that the Latino population might be in general a younger population because when you
Yeah.
immigrate, you're younger. The
Mhm.
people who are in bad shape, or who are elderly, they are not the ones who are going to immigrate. So there is kind of like a selection of the population just by the fact of the immigration. And again, that's another theory. Another theory, and that's what the Samoa effects refers to, is that when people are very sick and are close to die, they're going to go back to die to their countries of origin. They don't die here, so that also affects these
Yeah.
rates.
Mhm.
The point that I probably would like to make with that slide that you're bringing up is that, as many of your audience might have here, yesterday and today, they were releasing information about the life expectancy in general for the US population over the last year. And in the last 2 3 years, the life expectancy in general for the entire population of the United States have decreased compared to previous years. So for many years in the decade of the um, 2000, 2010, the life expectancy for everybody was increasing, but because
Mhm.
of the pandemic, the life expectancy decreased. And again, that's another way to emphasize the importance of prevention.
Mhm.
A lot of people in the pandemic die and had unfavorable outcomes were because they didn't have conditions under control. So the people who were at high risk for having bad outcomes from COVID were the people who had problems like obesity, poor
Mhm.
control asthma, diabetes, poor control diabetes, hypertension, poor control hypertension. And at the end, if you think about all these things, these are a lot of the times things that can be preventable. Again, I mentioned a lot of the importance of prevention. And two, if they happen, they're manageable. The
Yeah.
problem is that we have a lot of people in our country, and again, this goes beyond the Latino population, that
Definitely.
don't have health insurance, or they don't, even if they have health insurance, they don't go to a doctor. If they don't go to a doctor, their hypertension is not going to well managed, their diabetes is not going to well managed. And that was the segment of the population who was worst affected by the pandemic.
Mhm.
So again, making an emphasis and making a pitch for making sure that ideally in one day, that's kind of my dream, we will have universal healthcare for everybody in this country, and that universal healthcare is emphasizing prevention, that we have chronic conditions under control, and that we can prevent those conditions, that we can work on it. So yeah, these numbers are sad again because we see the difference between different groups, but also to think about that in the last 2 3 years,
And
our life
yeah,
expectancy has
and
decreased.
and they yes, they can be deceiving. Like
Yeah.
this is their so basically this is county health rankings page for Allegheny County. And like if you click on some of these numbers, they'll say for like low birth weight babies, they can show yes, I guess the Hispanic rate's very close to the white rate. Yes, but African Americans, I mean, some could argue, could it be like Hispanic families tend to be more cohesive and like a tighter family unit than maybe some Caucasian or African American families?
Yeah, I mean, again, as is what I mentioned before, there are many theories about this. For example, the influence of breastfeeding, that might have play a role. But again, I think there shouldn't be difference among groups. And one of the reasons that there are difference among groups is because the difference of access to healthcare and the difference to access to preventive measures, including prenatal care, as well as the access to health insurance. So yeah, this is sad, and it's sad that it happened in the United States, as the numbers are so different among groups.
Yeah, I mean, well, still, there's even among some people who have health insurance, many white Americans are stubbornly refusing to get the COVID vaccine because sometimes they've been been given bad information about it.
And that is a big problem: misinformation, disparity on the access of accurate and trustful information. So you're completely right, Paul. That's another problem.
Yeah, I mean, I know, I guess even in some of the Hispanics, like their home countries, even though maybe they might be poorer than the US, many of them do have universal health coverage, like Mexico and or Costa Rica. Some
Yeah,
of those
in
countries
Colombia
they do
too.
have.
So, I train back in Colombia, and people ask me about the difference of healthcare. And by no means I'm going to say that the healthcare system in Colombia is perfect, or health in general is perfect in Colombia. But in Colombia, with a reform that it was done back in the 1990s,
Yeah.
under that reform, everybody has health insurance. Even
Mhm.
if you're homeless, even if you don't have income,
Yeah.
you will have health insurance. Even to the point that in recent years, we had a big migration from Venezuelans fleeing the situation in their country.
Mhm.
And the Colombian government gave them some status so they could have access to the healthcare system. It's not perfect.
Yeah.
It's not the panacea. It's not what we
Mhm.
would dream. In many ways, we have advancing technology here that we don't have there. Vaccination, for example,
Yeah.
against COVID started here before it started in Colombia. But the one thing that I am proud about Colombia is that the fact that there is true universal health care. If
Mhm.
you don't have a job, if you're homeless, you can have health insurance in Colombia the same way that somebody who have a job and who has an income will have health insurance. So everybody in Colombia has health insurance as universal health care. And it is true. And, unfortunately, the United States is probably in the lower ranking compared to other developed countries in terms of health indexes and health insurance.
I know. I mean, we do have the same life expectancy. I haven't seen the numbers for this year or the last 2 years, but in the past, recently, we've had the same life expectancy as Cuba. I mean, you can give all your opinions about Cuba you want, but that's at least one objective thing
Yeah.
where they're
Yeah, I
equal.
mean, there are many indexes that you can look, and there are a big difference.
Mhm.
But I mean, again, what we saw through the pandemic, there were a lot of things that could be preventable. Making sure that everybody has access to healthcare, making sure that everybody has their chronic conditions under control, and
Mhm.
making sure that we can prevent conditions that can be prevented.
So,
Having better
so,
healthy habits. Yes.
so, like for some of the people you see, say from outside of Allegheny County, where some of these counties might be very pro-Trump. Like, do you feel that some of your patients from those counties do they feel more scared about things
Yeah.
than
The
anyone?
last 4 or 5 years have been very difficult in general for the community. Um, yes, people were concerned about discrimination, racism, and actually, some of the measures that were taken by the previous federal government had some impact that even if people, for example, were entitled to apply for healthcare access, they wouldn't apply for healthcare access because they were afraid that that would impact their situation in the future.
Mhm.
We had a family, this is not a Latino family, but we had a family, I believe they were from India, if not from India, from the Middle East. They
Yeah.
had been in Pittsburgh for many years. Um, they had health insurance for their daughter for the last, I don't know, 6, 8 years. And then suddenly they decide to drop the health insurance because they were very worried about some measures that the federal government had taken back in 2016, 2018. And they were worried that those measures were going to affect their future. So they decided to drop altogether their health insurance. This is a girl who qualified for health insurance. Their family qualified for health insurance, but they decided not to take it because they were concerned, given the fact that um, part of the family were not citizens, and they were not from their country, and they were by definition immigrants. So yes, a lot of the things that happened in recent years in our country had chilling effects in our communities. People are worried about racism. People are worried about discrimination. Um,
Mhm.
and unfortunately, the pandemic made things worse, because while we were saying in some ways we're all in this together, clearly we were not all in this together. Like some
Yeah.
communities were more affected than other ones, more vulnerable than other ones, and some people were carrying the heavy load. While people, the majority of the community were being asked to stay in their homes, others had to go to work because they didn't have any other options.
Okay. Yeah. So certainly it's all well, hopefully we've turned the corner, at least with respect to COVID. That's, well, at least my hope. I have been tracking the numbers, and I mean, I know out here in Cambria County, we do have some higher rates of transmission as well as one of the higher death rates in the county.
Yeah, rural communities were very highly affected by this. So, my pitch will be for everybody who can get vaccinated, get vaccinated. Yesterday, the FDA approved the boosters from Moderna and Pfizer. These are boosters who are specifically targeting variants of the virus. They're telling us that in the next week or two, we'll have those vaccines available for all 12 years and older. So I will encourage you who's eligible to get these boosters to get the boosters. For those who aren't get vaccinated, please get vaccinated. There is no reason to be afraid about the vaccine. If we have to be afraid about something, it's about the illness.
Yeah.
And even if you already contracted COVID, but you're not vaccinated, being vaccinated has the benefit that vaccines have proven to be safe, to be effective. And vaccines also have the benefit that while it might not be 100% that will prevent you from contracting the
Yeah.
disease, what it will prevent for sure is having
Okay.
desirable outcomes like
Yes.
death or hospitalization. So yes, I will encourage everybody to get vaccinated.
Okay, well, I did get the vaccine. I did have COVID a month ago, but my sister's symptoms, my dad's symptoms, fortunately, were very mild. So,
Well, I'm glad to hear that, Paul. And actually, that's also a testimony about the importance of getting vaccinated. So I'm glad you were vaccinated. And again, I want to encourage everybody who's listening us to get vaccinated.
okay. All right. Well, I guess that's pretty much all I had to cover. Is there anything else? I mean, well, I did think of one thing. Okay, so for some of the, do you have any mental health counseling available? Like for some
Yes,
youth?
thank you for bringing that up. The pandemic was a pandemic in many ways. It was a pandemic from COVID, but it also was a pandemic in many other issues. Social determinants of health were affected, of course, with people losing their jobs, with people struggling to make one thing. But also, it was a pandemic of mental health problems. We're fortunate to have had therapists for the last several years working with us, who is bilingual. Now we have another therapist, and over the next couple of weeks, couple of months, we're going to have the possibility to offer mental health services for our kids, both at the free clinic and for kids who have health insurance. So yes, we want to make sure that everybody take care of themselves, medically, physically, but mentally too.
Yes,
So
I do. So certainly the struggle for universal health coverage, certainly that still needs to go on.
definitely.
So, okay. Well, thank you for your time, Diego. I think
Thank you, Paul.
that's about all the time we had, and well, certainly I do remember those days in grad school when when I was helping you with your statistics. So
Thank you, Paul. No, I really appreciate it.
I
We appreciate
taught
all
you
the work
well.
you do. Yeah.
Okay. Well, thank you and enjoy the rest of your day.
Thank you, Paul. Have a nice afternoon.
You too. Okay.
Bye.